we're just gonna have to schedule for another appointment in the coming week, I think. Yeah, let me just go ahead and get those patient files pulled up for you. Yeah, so as you see here, just sign here on the lower part of the form to make the next part of your appointment, okay? Perfect, yeah, go ahead. Yep. Yep, just sign here, right there. Perfect, yeah. Okay, thanks, yeah, perfect. I'll put that in your patient file. I've got another patient here that I gotta attend to, so yeah, thanks so much. Yeah, your teeth look great. I'll see you next time. Sorry about that. I was just finishing up a dental cleaning with another patient, but now you have my full and undivided attention, so hopefully I didn't have to keep you waiting. So what can I do for you today? Okay. Yeah. Just here for basically a routine checkup. A little bit of pain in one side of your mouth. Okay. When's the last time you came in for an appointment? A little over 8 months ago? Okay. Let me go ahead and get my notebook here. Can usually pull up your patient file. Let me just see. Just kind of go flip through to your patient file. Let's see. There you are. I even had it with a little bookmark here. Okay. I'm just gonna, oops, as I throw my pen down, getting a little excited there. I'm gonna go ahead and just take down a couple notes, okay? But first, let me go ahead and just get on a pair of gloves. It's just before I handle any of the documents, you know. All right. And you can go ahead and have a seat in the chair, of course. I'm just gonna take a couple quick notes for your file, and then we'll go ahead and start taking a look at what might be going on in addition to your routine checkup. So, all right, go ahead. I know you've been here before, but give me your name again. And last name. Okay. I'm actually gonna have you look down a little bit. Okay. Don't mind the patient next door, they're a bit loud. He's on laughing gas right now, so. All right, and date of birth. And the year. Okay. Fill out this part of the chart real quick. Putting in your age. Gonna circle a couple things. Okay. Are you currently taking any medication? That's a prescribed medication as well as anything from over the counter? Okay. All right. I just have to ask a couple more questions and then we'll be able to start with the exam. Get this done. Okay. Do you have any kind of general anxiety or fear of the dentist? A little bit? Okay. It's understandable. Well, hopefully we'll make your appointment very relaxing today. It's supposed to be kind of calm. Just take a look at what's going on. All right. Have you had any kind of accident or traumatic injury to the mouth before that has caused the need for immediate dental attention or medical emergencies? No? Okay. No, I mean, that could be like a car accident or, you know, like a soccer ball or like a baseball to the face, something like that. No, nothing? Okay, good, good. Very good to hear that. Also, are you allergic to latex? No? Okay, good. We try to use latex gloves in my office, but sometimes we have to switch to nitrile just depending on the patient, so. Okay, that should be it for now. I'm going to keep your file off to the side, just in case I need to come back to it later. Okay, of course my pen is not wanting to cooperate. Hopefully you will be more cooperative than my pen. There we go. All right, so I'm gonna have you look up just a bit for me. Perfect. And what I'm going to do is I'm just gonna feel around a little bit around your jaw, just to kind of feel for any kind of irritation, any kind of sensitivity. And what that'll help me do essentially is just kind of document and feel around and make sure that I don't feel any kind of lumps or bumps, any kind of tenderness. If you do feel anything that kind of feels abnormal, or if there's any kind of pressure, just let me know. Try not to scream or yell, that can kind of startle me, but just let me know, either with like a verbal noise or just like a hand cue. You can wave your hand or something if that's more comfortable for you, okay? So I'm gonna go ahead and just get a couple things ready here. Go ahead and make sure these are good to go for later. Okay. So just what I want you to do is relax. I'm gonna lean you back just a little bit. Just a little bit more, like that, perfect. Okay, so I'm just gonna have you stay still for me, and I'm just gonna feel around your jaw. Just kind of feeling around. Okay. I'm gonna start on your left side. Just kind of feeling around gently. Let me know if you feel any kind of irritation or pain. I'm gonna pull on this side just a little bit. Okay. Okay, now I'm gonna go under your chin. Look up for me. Okay. Just kind of gonna feel around, palpate the area, Sometimes patients get a bit of sensitivity here, especially if you've had like an allergic reaction to something in the food that you've eaten. You'll get some swelling here under your chin, and that can prove to be a bit uncomfortable. So just trying to feel around for that. Look for any kind of lumps or bumps. Okay. And lastly, I'm gonna look on your right side. Same as the left side, but just kind of gonna feel around, okay? Just stay still for me, you're doing great. Okay. A little bit of sensitivity there. What about if I do this right here? No? Okay. A little further back on the side. Right there? Okay. I'm gonna put that in your patient file. Here, hold this for me. Perfect, thanks. Okay. Left, right side. Okay. Turn your head a bit to the left for me. Okay. Okay. So we are going to have a closer look at that. Thank you for the pen tip back. And actually, what I'm gonna do is just adjust you a little bit there. Okay, perfect. So I'm not exactly sure what the root cause of that problem is yet. So what I'm gonna do is I'm gonna do an intraoral exam, which basically means I'm gonna be examining the inside of your mouth. We're not gonna get to the cleaning yet. I just wanna make sure that everything is as healthy as it can be. We're gonna look a little further into that potential issue that you're having, okay? So I'm just gonna go ahead. These gloves are a bit tight, but I'm gonna go ahead and take these off. All right, give my hands a minute to rest. In the meantime, I'm gonna go ahead and lower you down a little bit, like this. I'm gonna take this dental bib. I got two by accident. I'm gonna just give you one for now. I'm gonna take this dental bib, okay? I'm gonna make sure it's unfolded. You can see it's a pretty thick material. Yes, you have to wear this. It's just for protection of your own clothing and just kind of keeping the workspace clean, okay? This is just going to help catch any kind of drool or spit that comes out of your mouth during the cleaning, okay? Okay. Go ahead and stay still. I'm just going to drape this on you. Okay, perfect. Need me to adjust a little bit? Okay, hold on. How's that? Better? Okay, good. Next, I'm going to just get my exam gloves ready here. These are a bit thicker latex. These will help protect my hands during the cleaning, okay? So, just gonna go ahead and put these on. These feel pretty good. They're a little small, but I find that the smaller gloves are more comfortable in the long run for examinations. Okay. Gotta make sure they're on nice and snug. Okay. So what I'm going to do is I'm going to take the dental mirror here, and I'm just going to feel around in your mouth a little bit, okay? It's going to allow me to take a bit of a deeper look into your mouth and just kind of see what that potential issue is, okay? I want to make sure that we try to get to the bottom of this for your dental exam, okay? I'm going to whisper a little bit just because I'm closer to your face, and I don't want to shout or alarm you. I want you to be comfortable while you're in my office, okay? So I'm going to go ahead and just have you open nice and wide. What happens if I tap here? Nothing? Okay. Just gonna look behind your teeth there. You do a pretty good job with getting the plaque off your teeth. That's good. Some patients that I have come in here just have really bad plaque buildup, and it's just, you know, it's not comfortable for them, and it's not exactly the most exciting thing for me either, getting that stuff removed. Let me just adjust my mask a little bit here. Okay. All right, I'm gonna go ahead and feel around. I'm gonna take the scaler tool out. We're not gonna get to the cleaning just yet, but I just wanna have kind of a good idea of what I'm working with here, okay? So I'm gonna go ahead and just feel around a little bit like that. Just kind of feeling around. Your teeth feel pretty good. No pain there. Remember, we looked on that side and I didn't see anything, so that's good. Okay. What if I poke there? Nothing? No? Okay, good. Okay, so I see a little bit of plaque buildup on this side under your lower incisors here, and while I'm just like lightly scraping, I can see a little bit of buildup, but it's nothing serious. What I'm gonna do, and your lips look a little dry. Do you need anything? Do you have any chapstick? You didn't bring any? Okay, hold on, I've got some. One sec. Okay, let's get the chapstick open. Let's get that mouth just a little bit. Okay. Your lips do look a little dry. That's the most painful thing ever, so go ahead and just kind of get that nice and cleaned up for you. All the way around. All the way around. Okay, pucker up a little bit. Okay, do a little bit more. There you go. Good job. Okay. Is that better? Okay, good. Okay, what I'm gonna do now is I'm gonna take my mirror tool here. And I'm also gonna take my scaler tool, and we're just going to basically scale your teeth a little bit and just get rid of some of the excess plaque, okay? It's not too much, but it's just kind of part of the standard dental procedure, okay? So go ahead and open wide for me. I'm just gonna check a little bit. Just gonna look around. Okay, the teeth look good so far. Like I said, just a little bit of plaque buildup, but it's nothing crazy. Okay. Yeah, I see it. Just a little bit, not too bad. Okay, so I'm gonna go ahead and put this mouth gag on you. It's just gonna help keep your mouth open so that you don't have to strain your jaw muscles while I'm doing the cleaning, okay? So just go ahead and open nice and wide for me. There you go, yeah. Just like that. Okay. How's that? Not too tight? Okay, can you go ahead and relax your jaw for me? Yeah, okay, good. All right, let's go ahead and do a bit of dental scaling, okay? So I'm gonna go ahead and use the mirror and the scaler, and I'm just gonna start scaling your teeth a little bit. Let's see. Okay, so a little bit there. A little bit of bleeding, but that's pretty normal. Okay. I'm going to switch to this other scaler here. This one has a shorter tip on this end for your gum line, so I'm just going to use that just to kind of poke around. Okay. Let's see. Put nice and wide for me. Oh, that's right, you're already opening. Okay. Okay. What I'm going to do before we continue the scaling is I'm actually going to remove some of the deposits off of your tongue because I can see that your tongue is a little white. Normally that's not much of an issue, but the whitening of your tongue can be a sign of some different health issues that you might be having. Additionally, it's just good to brush your tongue when you're brushing your teeth. Do you brush your tongue? You don't? Okay. Well, that might be why you have some of the deposits on your teeth, so we're going to just try and remove some of those with this tool, okay? It's got some really soft bristles right there. See? They're pretty soft. They're not hard. They're not sharp or anything. They're nice and soft for your tongue. So I'm just gonna go ahead and open wide. Stick the tongue out a little bit for me. Okay. Just gonna kind of clean a little bit. It's pretty relaxing, yeah. As long as you don't trigger your gag reflex. But yours is pretty good. That's good. I don't want to make you feel sick, you know. Just gonna keep going. See, most of it's coming off, so that's good. Okay, just a little bit more. Doing a great job. Okay. Gonna go ahead and set that in the autoclave over there. All right. Ooh. It's a little warm in here. Excuse me, I'm gonna go turn on the fan real quick. Just for a little bit. Okay. Yeah, let's kind of get the room aired out a little bit for you. Okay, so I'm just gonna do another visual inspection here. Just kind of check and see how everything is going. Stick that tongue out for me. Okay, good. Perfect. Okay. For now on that, now what I'm going to do is I'm actually going to get on some of my surgical gloves. I just want to try these actually. We can take a quick break. I'm going to go ahead and actually, let me take this out of your mouth for you. Okay. There you go. Okay, good. You need a tissue? Yeah, sure. Yeah, go ahead and blow your nose. Good. Okay, yeah, sorry, I had a nose run sometimes. Okay, you good? Okay.